I'll give you a different kind of an analogy. Supposing somebody gives you a marriage invitation and asks you to come participate in the marriage 10 days later, right? Today it is say 10th and 20th of October, he or she is getting married. And the moment you receive the marriage invitation, you have decided to participate in the marriage, or you have decided not to participate in the marriage. Welcome again. Marriage invitation given, you are receiving it. The moment you received it, you took a decision to participate or not participate. And then after 20 or 10 days, when it becomes 20th of October and it is evening 6 o'clock, reception is by 7 o'clock, at that point of time, I tell you, if your leg breaks, you will not go to hospital, you will go to the marriage because you wanted to attend the marriage. Right? If in case you don't want to attend the marriage, automatically you will develop some stomach pain, some head pain, some knee pain, some pain you will develop, and then you will avoid. It's all a matter of participation, willing to play. I'll give you one more example. Football is normally played 45 minutes and 45 minutes and 10 minutes interval in between. 45 minutes over, everyone was running. Unlike cricket, everyone is at any given point of time, every single second, every player is moving. You cannot see a stagnant player anywhere in the football. Everybody is moving. You cannot take two different photos, the similar photos during the entire 90 minutes of the game. So after 45 minutes, the break is given, and tea or cool drinks are being served to them. All the players come out. When it's being served, the guy who is serving you is looking at the leg, and then he says, looks like there is something there below your knee in the calf muscle or some area. And then you look at there, and then you notice that blood is coming out a little fast. And then you say, this is the reason why it's paining. So far you did not notice, so far you are not aware, because your mind is totally occupied in playing in the game called football or your life, and you did not notice it, no pain at all. And the moment the other person said, look, there is blood, and the moment you looked at the blood, then it started paining to you. And in the process of you undergoing the pain, it is paining, and then you are taking your cool drink or coffee. At that point of time, the bell rings, asking all the participants all the players to come inside. You throw away the cup and then you enter. Next 45 minutes non-stop, you are running all around with the football. No pain at all. You were hurt earlier, maybe 20 minutes earlier, but then 20 minutes you were playing, you did not know. Drill system, somebody pointed out, you did not know. The moment somebody told you, you got to know, and then the pain started. The moment the bell rang, it all disappeared. And then 45 minutes, no pain at all. After 90 minutes over, you come out, and then you come out limping. It is hurting. So far, here it is paining. There it is paining. Now, what happened? It's all in the head. It's not in physiology. We call them as psychosomatic problems. Whatever problem people have, I tell you, 80% of the problems that people have they have their root or origin or source or the foundation. They're only in the psychology. They're in the head. They're in your mind. They are only reflection. Whatever is you're describing to the doctor, to yourself, to other people in the family or other people, friends, whatever you're telling them is only a description of the symptom, not the cause, not the root, not the origin. The origin is in the head. It is in your mind. And 80% of the problems in the mind are only due to tension, stress, worry, fear, anxiety. Right? 80% of the stress or fear or anxiety or worry is only due to your perception. How do you look at a given situation around you? Well, what is happening in the family? What is happening in the office? What is happening in the road? What is happening wherever you are? So, whatever is happening in the road is only a sensory input. Everybody is looking at the same thing. You're also looking at the same thing. I'm also looking at the same thing. But then what happens is I am looking at it and interpreting it differently. This should not have happened. How can this happen? How can he say so? How can he tell me that? How can he do that? It is your interpretation based on the input given to you by your senses, all the five senses. Your interpretation created the stress or anxiety or fear or worry. And then this fear or worry, it reflected in the psychology and it reflected in the body, and everybody looks at the body. You also truly 100%, 200% believe it is in the body. It is not in the body. Body is in a problem because of mind. Mind is in a problem because of tension. Tension is in the problem because of senses. No senses. Interpretation of the senses. I can look at the pen and say, this is a beautiful pen. I can also look at the pen and say, this is good for nothing pen. The moment I say good for nothing, I have a problem. It's in the psychology. It's not in the object. The object is okay. The world is okay. Everything is okay. So health is okay. Longest you look at everything positively, automatically everything will become positively. One more thing. 2 years, the entire world was suffering from corona or COVID-19. How come some people in the same family get it, some people in the same family don't get it? How come some people get it here, some people don't get it there? It is all to do with your effective immune system or ineffective immune system. Corona has got nothing to do with it. Corona is there. If my immune system is okay, corona will do nothing with me. Already I am worried. Already I am in tension. Already I am not connected to people around. Already I don't have friends. Already I am not enough money. I am making enough money. Already I am in the firing line in the organization. And corona comes. Corona happily stays here, 5-star hotel. Wonderful. This is a place to stay. And then it comes and stays with me. 20 days, wonderful feast. Sometimes I myself become the feast.
Sir, sorry to interrupt you a couple of minutes, sir.
Right, I get that. I am telling, there are some people who eat everything, absolutely happy, no exercise, very, very healthy. There are some people who measure everything by the calorie. 90 calories are, 95 calories are, I will eat 90 calories are. They torture themselves and ultimately they end up in problem. No happiness in the food, no happiness in the health, no happiness anywhere in the world. It is all to do with your psychology. So whatever is happening around you, if you are happy playing with yourself, you're happy with yourself, self-esteem is good, self-acceptance is good, and self-confidence is good, and connectivity is good. I'm happy in the family. I happily have friends. I'm happily moving around everywhere. I'm doing a good job. Whatever job I'm doing smart, and I'm so happy with my life. Nothing will happen to me. I am healthy. Wherever I am, could be I am the president or vice president of the company, but then I have a lot of problems. How am I going to run this company with all these good for nothing fellows as my subordinates? Then you have a lot of problem as president. So to conclude, I am saying the whole world is beautiful or otherwise. It all depends on your perception. The 5 senses, use the 5 senses, look at everything, interpret everything, saying that it's all good, it's all a learning experience. I'm very happy playing in my life. Automatically, you will become healthy. I am done. Thank you very much.
Thank you, sir. Thank you very much, and very nice, wonderful short session. You talked about psychosomatic problems. It was very good pointers. This is a takeaway today. Now we like to invite Dr. Suresh Kumar Mutsa to do the lecture, please. Suresh, sir. Suresh, sir, are you there? Okay, he will join later. Yeah. Now we would like to invite the next speaker, Merlin Fernandez. Merlin? Yeah.
Audible?
Yeah, audible.
Yes, Merlin, audible.
Merlin,
I'll share my screen. Yeah, you can share. Before that, Salim sir will do intro part. Yes, sir.
Merlin Fernandez is a leading counseling psychologist from Goa. She is going to talk about the suicide prevention today. Over to you, Merlin.
Thank you. Thank you, Dr. Salim. So I hope you can see my screen. Is it visible?
Yes, Merlin.
Okay, thank you. Well, this topic is very close to my heart because I've worked with a lot of students and teenagers across different schools in India and abroad. Now, I want to tell all of you all, that you probably have someone in the family or friends or someone in the neighborhood who you probably know someone, who has attempted or committed suicide. Now, I want to begin with saying that suicide is preventable, okay? We have to understand that, it is our duty to save people's life. It is not just a duty of the parents or the counselors, but each one of us has an obligation or responsibility to save people's lives. All right. Now, I'll discuss with you a few signs that you can look out for as an individual or as a counselor, as a teacher, with the people around you. It could be your spouse, your children, the people who you serve, and what you can do as a person to help that person. Okay. So quickly, I'll go through the warning signs. If you can see my screen, is it showing my screen?
Yes, Merlin, please go ahead.
I've shown the warning signs. Is it showing on screen, the warning signs?
Welcome. Thank you. Good.
Slide has not moved.
Okay, I'll just, one sec, I'll just, I'm share again. Okay. So there are 4 warning signs that you got to look out for. One is academic or work related. Second is behavioral. The third is emotional, and the fourth is verbal. Now, when you see that a person is showing a steep decline in their performance, suddenly their performance has gone down. Maybe it's academic performance, maybe it's work performance. They're making a lot of mistakes, errors. They're submitting poor quality work, or they are not attending school or work. They're making excuses to stay at home. That could be a sign of depression. That could be a major sign the person is struggling mentally and needs immediate help. Now, behaviorally, you may see that a person has no interest in daily activities. For example, they may lose interest in their hobbies. They would enjoy going out, playing music, singing, dancing, playing the guitar, but suddenly they have no more interest in these day-to-day activities or hobbies. They may also have self-harming tendencies. Now, you got to keep in mind that not all depressed people self-harm. There are few of them who self-harm, okay, but not all depressed individuals self-harm. If you see teenagers, they might cut themselves. Okay, they might, just not just cut their hands, but also have cuts on their thighs. So you got to observe those signs. Sometimes individuals may also use cigarette butts to burn their skin, okay, or some hot rod to just relieve the pain that they're feeling. They may also have other signs. For example, they may withdraw from the people around them. They may isolate themselves, want to be alone in the room, not go out anymore, not talk to anyone. They may either sleep excessively or sleep less, eat excessively or eat less. Okay. Now, the emotional signs we see is that they get angry very often. Okay. It's not just sadness. They might also have anger outbursts for no reason at all. They may also have these mood swings. Okay. Sometimes you'll also see them struggling with feelings of guilt. They feel guilty about things that happened in the past, the things that they said, did, and they may carry that guilt with them, in the present, and not be able to cope with that guilt. Now, the verbal signs are very important for you to pay attention to. Okay. Many times people say things like, I want to go somewhere far away. Life is not worth living. My parents are better off without me. This world has nothing to offer. And you might think, wow, that's so philosophical. Some people are so philosophical, their poetries and their words, but they're actually indicating that they are on the verge of giving up on themselves. Okay. Some people may say verbally, and some of them may write down in their diaries, through poems or literature. And those are things that we got to look out for. Okay, because these are signs that 80% of the people who commit suicide give out. All right. Now, if you look, the 3 things you can see in depression is the person feels worthless, hopeless, and helpless. They cannot see a future that is bright. They cannot see that they can overcome their present struggles. They might feel worthless about themselves, their body, their own being as such. They question their own existence and they feel helpless. Maybe they have gone through a divorce. Maybe it's a family issue. Maybe it's a bankruptcy. Maybe it's failing examination. They cannot see a way out of the dark tunnel. Okay, so these 3 important signs that you will see in people who are depressed and suicidal. Even social media. Social media also, all of us on social media, on WhatsApp, on Facebook, Instagram. Now, if you have friends and family on Instagram and Facebook and other platforms, you will also notice signs of depression or suicidal ideation or tendencies on that platform. For example, a research shows that people who post black and white pictures very often might have mental health conditions. There are people who also post self-harming pictures online. Sometimes they may post pictures of guns, knives, okay? They may post sad pictures of them crying or in a sad position and some sad quote. Now, those are all signs for you to look out for, okay? And then support this individual, see if they need help, all right? Now, coming to how to respond to a person who's suicidal. The first thing you got to do is you have to be an active listener. Now, we all take pride in being listeners. We all think we are very good listeners. But you have to ask yourself, how good are you as a listener? Are you there to judge that person? Are you condemning that person in your mind? Are you giving them advice such as, don't worry, be positive, stay strong, never give up? Then it's not going to help that person. Okay? Listening involves you understanding what they're going through, you empathizing with their emotions, you affirming their feelings, you saying to them, I can imagine how painful this must be for you. I can understand the frustration you're going through. You seem to be confused with things right now. So you've got to empathize with them. You have to probe about their life, the things that happen to them, ask relevant questions about their present life and their future plans, and allow them to vent out. Allow them to vent out their stories, their frustrations, their pain to you. And listen, not tell them, not dismiss their emotions by saying, don't worry, you get through this. I'm here for you. Okay. No giving false assurances. Because people always, they want to avoid people. They don't know how to handle when someone talks like this. So they'll let that person say, they'll make that person feel like, okay, we are there for you and we'll be there for you. But they're not actually there for them. Okay, so avoid giving false assurances to people. Make sure that you are keeping the person's safety a priority. Now, a person who's suicidal will say to you, do not inform my parents, my spouse, my family. Your duty is to inform someone who can be trusted, because their safety is a priority, not the confidentiality. Okay, we have to ensure their safety first, then everything else follows. And believe me, in this case, almost all the children and adults who are suicidal will tell you, do not inform anyone. But it is your duty to inform somebody who they trust. It can be a parent, it can be a guardian, an auntie, uncle, relative, a friend. It can be grandparents, somebody who can get them immediate help. Okay.
Murli, sorry to interrupt you. You have a couple of minutes, please.
Thank you, Dr. Sunny. Also, make sure that you label such behavior as attention seeking. We always say things like, oh, that person is showing off. That person wants attention. This person wants, some kind of attention from people, sympathy from people, and that's why they're doing all these things. So avoid doing this. Get this person immediate help first. Now, the treatment for people who are depressed and suicidal may involve a combination of psychiatric treatment and counseling, or one of them. Okay. In severe cases, people need psychiatric intervention. All right. They need medications to stabilize their mood. Counseling alone cannot help. Okay. And counseling also involves counseling that person and the people around that person. It may be that person's spouse or the parents or the siblings. So that we ensure that environment that person is in is conducive for their mental health. Okay. And we're going to keep this in mind, that seeking help from a psychiatrist is not a big deal. Okay, just say when you take medications for your ailments, for your physical health, for all the sicknesses that you have. Similarly, it's okay to seek help from a psychiatrist for your mental health issues. All right, and so on that note, I would like to say, thank you for this opportunity, Mr. Nanda and Dr. Salim. So over to you.
Thank you, Merlin. It was a very wonderful session. You nicely talked about the social prevention, and you described the social individuals and the social media, rightly connected with wellness, helplessness, all those things, and how to responding, and like a treatment called anti-depression, lifestyle, psychotherapy, everything. It was a very wonderful session. Now I'd like to invite Mrs. Sunanda Ravi to give the lecture on natural therapy. I would like to give some intro about Mrs. Sunanda Ravi. She is the founder and director of Manasa Supkara. She is a positive psychologist, and she is doing counseling to post-trauma care for patients at the Ravi Arthacare Hospital, Hyderabad, for 15 years. She is a student counselor at the Priyanka College, Hyderabad. She has given 45 plus speeches in webinars, seminars, TV workshops, and interviews, all those things. She is specialized in positive psychology, art therapy, eco-psychology, and ecotherapy. I would like to hand over session to Mr. Sunanda Ravi. Ma'am, over to you.
Yeah, thank you, sir. I think PPT is visible, right?
Yes, visible, yeah.
Yeah, friends, today I'm going to share about how nature affects our mental health. We can improve our mental wellness by spending time with nature. That upcoming slides I'm going to share. According to our recent survey, 14% of Indians suffering from mental illness, disorders, something in our country. That too after Corona, lot of people are suffering these mental health issues. Then 19.86% adults are experiencing mental illness. In this, most of the cases in India, what they are facing is depression, schizophrenia, then autism, ADHD. These are the common problem. ADHD, then schizophrenia, these we can say genetical disorders. It plays a major role. Then common stress, anxiety, that we can cure. We can better by doing walking or spending nature sometime, we can improve ourselves. This by seeing slides, we can know what is green space and blue space. Green space, spending more nature walking or spending time in parks, playing outdoor games. In that way, we can improve our mental wellness. Then blue space, even by seeing even fountains or lake, riverside, when we spend time, some time, we feel freshness, we will get more oxygen. In that way, we can improve ourselves. Then by seeing this picture, when we adventure outside a hilly area, how we feel? We feel betterment, right? Then next slide is by spending nature, our oxytocin, dopamine levels will be increased. Due to this, we can improve our emotional as well as psychological wellness. Then the recent survey, how we psychiatric problems we can overcome by spending nature. Even school kids also, they can improve when they are spending recess time or lunch time, when they are going out or eating outside in a playground. They can focus concentration on the studies. The memory powers will be improved. We can improve their psychological illness. Then next is recent survey from Canada University, how they're spending, when they are spending outdoor activities, their problem solving skills, then critical thinking power, sharing, social relationship will be improved. Then kids, when we encourage, usually we won't encourage, we the parents, we won't encourage outside activities. Just we'll give them some tab or phone to them, and they have to sit in front of us. They spend some time inside only. So after Corona also, even they cannot hold their pen, and they can, some kids are, they forgot to write. How to write also they forgot. Then next is experience, then connection. We can, when we connect to nature, we feel a lot of good feeling, positive emotions. Then the purpose of life will be changed. We can make a journal, affirmations, lot of things we can do by spending outside. We can sit in the mid of the wood area or even park also, we can sit and we can spend some time. Then different greater health and well-being will be promoted in group activities also. When we spend time trekking or jogging, then even cycling also we can do, marathon race, a lot of activities are will go around us, that we can improve. We can make a social relationship also. When we mingle with friends, like a green gym or green time, then green activities, we can encourage our kids as well as even elders also. We can introduce spending time in sunlight or sunset or sunrise time. We can spend outdoor activities by walking, jogging. Then like simple games, badminton, football, we can encourage our kids so that they will improve their psychological well-being as well as physical well-being, so that we can maintain our lifestyle disorders, what we call uh, high BP, then diabetics, cancer. Nowadays, even heart patient also they can overcome by doing all these green time activities. By spreading this awareness and creating mental health is more important than physical health is more important nowadays. By conducting such type of activities, we can reach out more and more people. Yeah, I can conclude my session by with this topic. Yeah, thank you, sir. Over to Salim, sir.
Thank you, Sunandaji. Nicely, you talked about nature therapy and its benefit. Rightly, you explained about the green space and the blue space, and you very well connected with our relationship with the nature, and we understood the benefit of that nature and with the happiness, all those things, and memory power, how to increase the memory power with this therapy, natural therapy techniques. We understood, and the connection with the nature is very important. That's what we realized today. Thank you, ma'am. Now, I like to invite Dr. Suresh Kumar Muralidharan sir to give the speech. Suresh sir. Suresh sir, are you there? Okay.
Thank you, sir. Yeah.
Yeah, I would like to invite Vishal Muhunt. He is going to talk about the role of family in mental health subject. So I want to give some introduction. Vishal is a leading psychologist from Salem, Tamil Nadu. She is a specialist in family therapy and counseling. He is the leading psychologist. And over to you, ma'am.
Thank you, Salim sir, for this warm welcome. Myself, Vishal, a curious learner in psychology field. Thanks for my beloved Sunandam ma'am and Decon Positive Mental Health for giving me this wonderful opportunity to share my views on the role of family in mental health. See, friends, family is a very, very important one. We all know we humans, Homo sapiens, are social animals. Isn't it? Family is the smallest social unit. Family is a trustworthy ecology wherein a safe, comfortable, loving, and caring environment a child can develop positive relationships. The family is a place where all members serve and help each other so that children find themselves cared for and have the opportunity to care for others. Parents' behaviors are easily transmitted to children. As a modeling, they learn from parents. The morals, the values are interchanged to generations by family very easily. The family helps the young ones to increase their resilience, problem solving, communication, which is much needed to socialize with others and live a healthy and prosperous life. So, how should a healthy family must be? Yeah, ideal family, a functional family. Family, how must it be? A minimal disputes between parents or parent and child. There is an opportunity to express a desire, full of love, disciplined, and the boundaries to all must be clear. There is an opportunity to be independent in thinking, feeling, and behaving. Mutual respect must be respect between parents and the children, and among the parents also, and among all the family members also. There must be family conferences in solving problems or difficulties, establishing togetherness between parents and children, and parents must have stable emotions, being well off in economics, and practicing moral and religious values. As I said earlier, this will make a child mentally healthy and strong human being also. Children who grow up in families with a dysfunction have a greater risk of being disturbed in their growth and development. Even they can become the antisocial personalities also. We can see characteristics of the dysfunction families will be the death of one or both the parents separated or divorced. The relation between the parents is not good. That meant the poor marital issues like that one. The relationship between parents and children is not good. We can see as a poor parent-child reality, or the communication is not good between them. A tense and without warmth atmosphere, parents absent, parents are busy and rarely at home, one or both parents have personality disorders or psychiatric disorders. A child who upbringing in this dysfunctional family will be arrogant personalities or else low motivated personalities. Now, what is our work as mental health professional in this? We can encourage and teach them the 7 effective family habits, which Covey, a researcher, proposes. The first habit is be proactive, being an agent of reform in the family. The family and its members are responsible for their own choices and have the freedom to choose based on principles and values rather than on the conditions or moods. The second habit, begin with the end in mind. That means see in the larger vision, see in the long vision. You don't live in the day-to-day life. The family builds its own future through efforts to create a mental vision and goals for various problems, big or small. See a larger vision for that one. Third habit is put first things first. That means the making the priority first. See, we all have the works from morning to till night. We all are engaged. We all are busily scheduled. But in all the busy schedule, make the family as the first priority. That will give you a bondage to your family, and that will make your family very strong and functional family. The fourth habit is the think win-win situations. So always don't think about yourself and don't think about the one person in the family. Think about all the persons in the family. All must have the win-win situations. Move from me to we situations, me thought to be thought. That will make the family very close enough. The fifth habit I can say, seek first to understand, then to be understood. To solving problems, anything, don't think others must understand myself, my first. First, you understand other family members in the empathetic manner, and then after understanding their thoughts and needs, make them to understand you. That will be a very good habit. The sixth habit is to synergize, to maintain the family spirit of love, learning, and contributing to one another. Give some time and hold all hands together in all the situations. And the seventh one, and the not the least one, sharpen the sharp to cut anything. So we must sharpen the sharp. So like that, sharpen your family with practice habits, cultures, economic, and all the thing. Practice healthy habits so that your family will become more resilient in all the situations. To get a beautiful society, we must take care of our family. A functional family produces good and healthy personality people. So crime rate will be reduced. Even we can avoid many mental disorders. Say, as our Sunanda ma'am said, the anxiety, stress, and these all can be avoided. This is not the hereditary one. Some hereditary factors are there, except, but most of that one we can avoid. So we can avoid this and into a particular level, and we can make the family enjoyable, and so that our society will also be enjoyable. To make our society healthy and a beautiful society, we must take care of our family first. All our family members must be happy and healthy in mentally and physically. That will make the society is good. This is my thoughts about this one, and thank you for the opportunity. Over to you, Salim sir.
Thank you, Vishal ma'am. Nice crisp session on time. So you talked about the entire 360-degree of family and family therapies and all those things. You rightly talked about habits and healthy habits and the empathetic, larger vision and a lot of points on the importance and the benefits of the families. As proverb says, charity starts from home. So the relationship mental health also start from the family. So thank you, Vishal ma'am. Now I'd like to invite Dr. Suresh Kumar Murugesan sir from Singapore. He is the researcher, professor, psychotherapist. So he's right now heading the position of Department of HOD and the Department of Psychology, American College, Madurai. He is the founder of TNCC and the co-founder of CPE. He is the director for Yellow Pond Counseling Center and the Red Pond Educational Counseling Research Center. He delivered a lot of talks on radio talks, more than 500 sessions, online sessions he conducted. He got a lot of awards. With the kind note, I would like to invite Dr. Suresh Kumar. Sir, over to you.
Yeah, thank you so much, sir. Am I audible?
Yes, sir. Yeah, audible, sir.
Okay. So as you mentioned that I'm from Singapore, I would like to quote some of my observation last 3 days, 3 to 4 days. I hope you all know about that. It is a global concern. Mental health is a global concern. And when we look at that, the initiative taken by the government of Singapore, it is totally unique and we need to follow, I can say. There are one thing. The first one is they given that importance to conserving or preserving the nature what they are having, and they are recreating the nature. That is the one thing. As we all know that in most of our webinar session, we are insisting we have to give importance to the nature, and when we are close with nature, our mental health will be good. One thing. And second is I don't know how many of you are aware about the other side of Singapore. I come to know that the most mental health problem is there among the Singaporean people. Most of the people are having. And they are saying that the average mortality rate is on 85. But due to stress, there are a lot of people are committing suicide, and high level of stress-related problems are very high among the Singaporeans. It is because they are not having the work-life balance. Now the government make an initiative to promote the mental health of people here. I'd like to let you know what are the strategy they have taken. One is about they are having that community get together function. It is mandatory every week, once in a week, they have to together and they have to do something. It may be exercise, it may be sharing information, and it is a mandate. Think about it in India, and it is no need for that. Every day is a community day for us, because when we go away for taking the tea, we will interact with other people. But here it is totally different. When I go to the different places, what we observe that the only people other than Singaporean are talking in the street. But here they never go and interact with anybody else. They never talk with anybody else. This is another interesting thing I found that. And the third important thing, what I found from here, the government made an initiative to taking care of the happiness programs. Happiness program is allowing the elderly population interact with the kids. It is very new to me. When I'm hearing this information, they given the brochure to celebrate that mental health day, and they given that elders are mandated to interact with the kids in that particular. It maybe they are having the creche or play school. They have to go and interact with them, and they can share the information. This is my takeaway, I can say, and I will come to my. I will take another few minutes for sharing this positive mental health. As we all know that color psychology. There are different colors are there, and it has a different interpretation by different psychologists. But commonly, when we know that happiness means there's a particular color, and the peaceful we are having the particular color. I don't want to give the name of the color, and you can search it and you can find it. And color has a huge impact on our happiness for our positive mental health. Choose the colors wisely. And here, mostly they will say that if there is a festival, they use the color. Colors are directly related to our happiness, and find out the right color for you, because it is vary from person to person. I would like to say that a particular person prefer the color, they feel more happy. When you're happy with that color, you can continue. Don't read a particular article and they said that, okay, I have to change the color. Don't do that. So that is the thing I would like to say here. And second takeaway for you is do regular exercise, not for physical alone. When I say that regular exercise, we think that only we have to do the physical exercise. I have gone through one of the article. I just surprised that. What was that? There are Buddhist monks. Okay, they never do that physical exercises when they do meditation. And with that meditation, whatever the benefit a person can do regular exercise for an hour, and that thing they can get it in 15 minutes. Something we don't know how to do that thing. That's why we are doing these things. And to try to find out how to do that. That article, what it's saying that a person doing rigorous physical exercise, okay, they are getting particular benefit. The same thing, it can be obtained by the Buddhist monk also. For 15 minutes of exercise, it may be mindfulness practice, what it may be. You try to discover that what is the practice you have to follow, how that will helpful for you. And the third important thing, connect with you. Globally, we have to connect. I think the webinar series made me have more number of family members. Earlier, I had only limited. I would like to quote the two examples. Earlier, when I go to Chennai, I used to meet 1 or 2 people. If now I'm going there, I have to meet at least 10, 20 people, and the remaining people are fighting with me. You are not made a call and you are not coming. And try to make it just such a thing, and connections will give a lot of benefit for us. And you have your 2 friends, X or Y, and they are the one who can able to make and attend your call at any time, even if you're calling at a late night, whatever it may be. If you have that such a friends, I think you are blessed. So with that, I can, with a few inputs for our taking care of our mental health, I can conclude here. Thank you so much for giving that wonderful opportunity. And I can say that the Deccan positive mental health will drop in coming years. With that note, thank you all. Thank you so much.
Yeah. Thank you
Thank
for joining with us and spending time with us.
Thank you, sir. So, in your busy schedule, you give the time and a lot of takeaway from you about Singapore, and this is like a real kind of practical session. You delivered a psychology aspect of Singapore. We learned a lot about the elder younger relationship, people interaction in Singapore, and you talked about the connection in globally. So, color therapy, regular exercise, and a lot of takeaway from you, sir. Thank you, sir. Thank you very much. Now I like to invite. Now I like to invite Anitha Ramachandran, ma'am. She is the psychologist and primary grade teacher from Sharjah, United Arab Emirates. She is completed MPhil from Animans, Bangalore. She is going to talk about the psychiatric rehabilitation. Ma'am, over to you.
Thank you, Salim sir, for that wonderful welcome address, and thank you to the organizers for giving me an opportunity to be there in this platform and share a few things about psychiatric rehabilitation. The topic that I've taken is psychiatric rehabilitation. Again, talking about the World Mental Health Day. The theme of World Mental Health Day this year is ensuring mental health and well-being for all becomes a global priority, but this starts with focusing on prioritizing your own mental health. A person with good mental health is important because it can help you to cope up with the stresses of life, be physically healthy, have good relationships, make meaningful contributions to your community, work productively, and realize your own full potential. The World Health Organization conceptualizes mental health as a state of well-being in which the individual realizes his or her own abilities, can cope up with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to the community. And taking into consideration the disability, the psychiatric disability, that is a disability caused due to a psychiatric illness, I have selected schizophrenia here. Schizophrenia is a serious mental disorder in which people interpret reality abnormally, and schizophrenia may result in some combination of hallucinations, that is perceptual disturbances, delusions, thinking, disturbances in thinking, and extremely disordered thinking and behavior that impairs daily functioning. And this can be very, very disabling. People with schizophrenia require lifelong treatment. Schizophrenia also involves a range of problems with thinking, that is cognition, behavior, and emotions. Signs and symptoms may vary from each individual to the other, but usually involve delusions, hallucinations, disorganized speech, and reflect an impaired ability to function. The other symptoms may also include significant impairment in the way reality is perceived and changes in behavior related to those persistent delusions. The person has fixed beliefs that something is true despite evidences to the contrary. Again, persistent hallucinations can be there. The person may hear, smell, see, touch, or feel things that are not there. In the absence of perception, you have all these disturbances. Again, you can have delusions related to experiences of influence, control, or passivity. The experience that one's feelings, impulses, actions, or thoughts are not generated by oneself, are being placed in one's mind or withdrawn from one's mind by others. Thought is something which has ego boundaries. But what happens in schizophrenia is that the ego boundaries are lost, and the thoughts which are very private to the individual are known to others. That is what the patient experiences that. And thoughts are not generated by oneself, are being placed in one's mind or withdrawn from one's mind by others, or that one's thoughts are being broadcast to others. Disorganized thinking, which is also there, which is often observed as jumbled or irrelevant speech. Highly disorganized behavior. The person does things that appear bizarre or purposeless, or the person has unpredictable or inappropriate emotional responses that interfere with their ability to organize their behavior. Again, you can have positive symptoms. You have what is known as the florid psychotic symptoms, the hallucinations, delusions, disorganized speech, poverty of speech can be there at times. You can have symptoms of moods related to that. Negative symptoms. Negative symptoms are a little difficult to handle. Once they have started on, it is difficult to for them to function with negative symptoms such as limited speech, restricted experience and expression of emotions, inability to experience interest or pleasure, and social withdrawal. Extreme agitation and slowing of movements, maintenance of unusual postures can be there in catatonic schizophrenic patients. That is a type of schizophrenia where they also respond very well and quickly to the antipsychotic medication. Schizophrenia affects approximately 24 million people, or 1 in 300 people, 0.32% worldwide. This rate is 1 in 222 people, 0.45% among adults. It is not as common as many other mental disorders. Onset is mostly often during late adolescence and between the age group of 45 to 60 years and the 20s, and onset tends to happen earlier than in men than among women. A recovery-oriented approach giving people an agency in treatment decisions is essential for people with schizophrenia and for their families and caregivers as well. Now, the other thing is the movement towards community mental health. Efforts to transfer care from the mental health institutions. We are talking about the mental health, the hospitals where mental hospitals to the community, that needs to be expanded and accelerated. It has to go at a fast pace. Such efforts start with the development of a range of quality community-based mental health services. Options for community-based mental health care include integration of the primary, the community-based mental health services into the primary health centers, general hospital care, community mental health centers, daycare centers, supported housing and outreach services for the home-based support. Sometimes as mental health professions, we can also go and visit, make home visits and find out about the management plan, and we can have a detailed management plan if after meeting the families. The engagement of the person with schizophrenia, family members, and the wider community in providing support is very, very important. Again, schizophrenia is frequently associated with significant distress and impairment in personal, family, social, educational, occupational, and other important areas of life. A range of effective care options for people with schizophrenia exist, and these include medication. Medication is very, very important. You have to take medication for a lifetime. And psychoeducation, educating the family members, family interventions, cognitive behavior therapy sessions, psychosocial rehabilitation, that is involving the family members in the process of treatment, and life skills training. Facilitated assisted living, supported housing, and supported employment are essential care options and should be available for people with schizophrenia. Coming to the main aspect of psychiatric rehabilitation, the main vision of psychiatric rehabilitation is to enable individuals with mental disabilities to recover and to live as normally as possible in the community. So you're trying to make them live in the community. The mission of this psychiatric rehabilitation is to engage patients and their families or caregivers in a collaborative treatment process. So all the mental health professionals are involved in that. They will also teach skills and provide support for fostering illness management. So the family needs to handle certain things. They have been managing quite well the illness, and they need to be. We have to ask them to. We have to listen to what they have to say. And there are so many things that we can. The family is a very powerful, agent of socialization. Also, we can learn a lot from them. And fostering illness management, psychosocial functioning, and personal satisfaction. Again, psychiatric, the Diagnostic and Statistical Manual of Mental Disorders gives a definition of disability, symptoms that cause impairments in social, occupational, or other important areas of functioning. The modalities of rehabilitation should cater to the reverse, or it should compensate for the impairments and disability that has occurred due to the mental illness, especially the serious mental disorder, schizophrenia. Psychiatric disability represents one or more functional abnormalities that interfere with an individual's autonomy in work, education, family, and social relations, recreation, and independent living. Again, the word impairment becomes very important. You have pathological abnormalities of the brain and the functions of the central nervous system, which is termed as impairments. So that becomes a biological cause is always there sometimes to the illness. And that is why you need medication. Impairments, again, can be measured and can be seen as dysfunctions of learning, concentration. There can be disturbances in perception, decision-making, judgment, and memory also. Cognitive, that is thinking, and symptom impairments can also lead to disability. Cognitive impairments may limit what and how much a person can learn or perform at work or in the school. If verbal learning, for example, if verbal learning and memory are seriously limited, a person is not likely to perform well in school or in a job that requires listening, reading, and remembering things. Cognitive impairments in schizophrenia, such as poorly sustained attention, can be there, inaccurate perception of social and emotional cues, limited verbal memory, and deficits in planning. Person is not in a position to plan. Decision making and problem solving have also been associated with disabilities in socialization. Person does not interact with others. He was all right. Suddenly he's developed illness. He's totally withdrawn. Employment, he faces a lot of problems. Self-care skills have got affected. Money management is a problem, and treatment adherence. Again, he has to take medication. Because of the side effects, sometimes patients have a tendency to withdraw their medication. They have to be convinced either by the family or the mental health professionals treating them to continue to take the medication. Otherwise, they would have a relapse. There are high chances of relapse. Disabilities can also be seen from symptom impairments because symptoms can preoccupy a person and interfere with performance of skills and activities of daily living. When the community or the society does not provide anything supportive and accommodations to individuals with disability that can enable them to function more normally and achieve their personal goals, handicaps are said to be present. Handicap restrict the range of person's participation in everyday life and citizenship. He's not in a position to perform everyday tasks, and that becomes a handicap. Again, problems that mentally ill or the persons with intellectual disability have in obtaining is to continue to be there in their jobs because of the lack of initiative and problem-solving skills, poor learning and deficient social skills. Social skills is a very vast topic by itself. In a supported employment specialists and job coaches assist the individuals in obtaining a job, teach them or her to successfully perform in the job, and serve as license among the patient employers and responsible mental health treatment team. Again, the principles and practices of psychiatric rehabilitation is, the first principle is recovery of a normal life in the community is possible for many persons with mental disabilities if best practices of rehabilitation is provided. For example, involving patients and their families in the functional assessment. It helps to identify certain personal goals. By the term functional assessment, it's a very big term again. It helps to identify personal relevant goals to enrich and bring meaning, self-respect, and optimal independence and satisfaction into one's life. Again, evidence-based pharmacological, that means related to medication, and psychosocial treatments related to the family, involvement of the family, and to remove the symptoms and cognitive and emotional impairments that interfere with the quest to reach one's goals. So this would come under a detailed, this one, a functional assessment. And motivational enhancement instills hope for the future.
Sorry to interrupt. Yes. You have a couple of minutes. You can try to.
Sure. I'll try to finish fast. Yes, thank you so much. Structured and supportive programs for work, school, housing enable patients to achieve higher levels of functioning. Again, teaching families and patients to improve their coping, communication skills, problem-solving skills helps to build realistic expectations and generate positive reinforcement for progress. You need to be proactive, long-term. It has to be long-term. It has to be intensive. It has to be flexible. You have to make changes according to the needs of the patient, and indefinite case management by personal support specialists. You need to have, in order to maintain the number of cases and manage the number of cases, so you need to have a case management personal support specialist, assist patients in using survival skills for community integration. Enlighten and recovery. Oriented administrators and managers can incorporate best practices into the competencies and performance standards of clinicians and the multidisciplinary team. The second principle being impairments, disabilities, and handicaps can be reduced or overcome by integrating both pharmacological, as I had told you, that mental illness, we cannot ignore medication. That is very important because mental illness has a biological cause. And psychosocial services towards the family, and advocacy, for example, to improve clinical, educational, vocational, that means to learn a skill, and government policies and programs should also get involved in the process. Advocacy in terms of groups, and stigma busting, that's very, very important in mental illness. Dealing with handicaps that interfere with patients' full participation in society requires major efforts and often reside in social advocacy than in clinical interactions. For example, we've had the Disabilities Act in America, which prohibits employers from discriminating against persons with disabilities. So those kind of legislations can be very, very useful. The mentally ill persons harmed by stigma at the community level, at the family level, cultural and economic levels, experience feelings of guilt, shame, rejection, devaluation, and bruised self-esteem. So they do feel very bad. And again, the third principle is individualization of treatment is a fundamental pillar of rehabilitation, matching treatments to individual level of cognitive, behavioral, and social functioning. Even in group activities, individualization can have a very therapeutic effect, and group families can meet together and share their problems and find solutions to their problems. The only thing is that the group therapist needs to keep it confidential. And evidence-based outcomes, research studies, clinical trials can also support some of the treatment plans. You can also alter and make changes in your treatment plan accordingly. Rehabilitation assessments and interventions must be adapted and must be congruent with the cultural context of the family. You just need to take the cultural context of the family. Empathy is a therapeutic alliance, requires understanding of an individual's spiritual belief, customs, and values. Very important. Religious belief, the cultural beliefs also. Religious beliefs are also associated with well-being, personal adjustment, and coping with medical and psychiatric illness or disorders. Rehabilitation is more effective and recovery more rapid when patients and families are actively involved in planning and participating in the treatment process. Families should be involved and they have to be an active participant in the treatment process. Again, fifth is integration and coordination of services are essential to enhance progress and recovery. For example, you have psychosocial that is related to the family. Pharmacological treatments can be integrated at 3 levels. For example, patient can be there, the mental health practitioners can be there, the agencies contributed to the systems of care. For example, mental hospitals, the primary health centers can be there. Pharmacological and psychosocial treatments, psychoeducational programs are also important.
Excuse me, Anita, ma'am.
Yes, fine. Just few more minutes, ma'am.
Yeah.
Sorry to take more time. I'll finish, ma'am.
Yeah, it's okay. Yeah.
Patients require education to understand how medications and psychosocial treatments can be mutually beneficial, or they can be a conflict in that. They have every right to understand the side effects. They will want to know about the side effects that these antipsychotic medications produce. For example, sedation can be there, tremors can be there, and difficulty to walk. So some of these, they will ask the therapist. The other thing is integration at the level of treatment teams is found to be very effective. The patient's progress needs to be monitored and communicated among the responsible clinicians. Discussions with the family also needs to be communicated to the team. Successful integration of services provided by different agencies depends on the patients or families or teams, but rather than on organizational actions. Policymakers are also important. They have to also contribute towards this. Funds can be there. Again, building the sixth principle in psychiatric rehabilitation is you're building on the patient's strengths, interests, and capabilities. And that is the cornerstone of rehabilitation. The aim for life is that more rewarding and meaningful despite the imprint of symptoms. In spite of the person being mentally ill, you have an imprint of symptoms, cognitive and emotional impairments, and disability due to the psychiatric illness. Focus will be on what the patient is able to do at that stage and how the patient can solve problems with whom the patient has developed a relationship, good relationship, whether it's a therapist or the family members or the community people, and whether the patient has accomplished the task and has achieved the goal. Progress by patients towards attaining their personal goals is facilitated by using social skills to build on existing strengths. Again, social skills get affected when a person has schizophrenia. So, and it is a vast topic by itself. Just few more minutes, Sunanda ma'am. Rehabilitation takes a lot of time. It proceeds incrementally and requires perseverance, patience, and resilience by patients, families, and practitioners. Patients and practitioners, that is mental health professionals, should also be cautioned to avoid excessive zeal in pursuing goals. You identify relapses, anxiety, symptoms of anxiety, irritability, problems of concentration, other warning signs of relapse, and they are often best guides for having or for making changes in the rehabilitation program. Hope or realistic optimism for a better future, empowerment that comes from success in reaching one's goals, spiritual strength that can overcome adversity and connect people with faith and hope, self-help and support from peers and other groups, destigmatization of mental illness and those who suffer from it. So these are the few things which I thought I should mention. The word refresh and the word road to recovery. You have relationships for our people with whom we share experiences, feelings, and dreams, empowerment, self-respect that comes from participation, success and achievement, family. 2 more minutes, just 2 more minutes, I've finished. Family, cordial relations with reciprocity, perfection, and concentration, recreation, enjoying community activities in normal places, education, learning the knowledge and skills required for independent living, spiritual strength for the struggle for personal meaning, belief that one is not alone, hope. Having goals with positive expectations for self-improvement. And I'm done with my session, and thank you so much. Sorry.
Thank you, Anita. It was a pleasure. A beautiful topic. You can elaborately take next time. Yeah, thank you so much. Yeah,
sorry for exceeding the time, ma'am.
It's okay, no issues. Yeah, now I will call upon Salim sir, our beloved sir. He is joined from Dindukal. Yeah, sir, please go ahead.
Okay, ma'am. Thank you. My screen is visible?
Yes, sir.
Yeah, is it visible now?
Yes, sir. Clearly.
Okay. Good evening, Ananda. Today we are in October 10. We all know is the World Mental Health Day. Actually, this World Mental Health Day is an international day for the global mental uh, health education and creating awareness and advocacy against the social stigma. We all know it was celebrated from 1992 at the initiative of the World Federation for Mental Health. Actually, it is the association, it's a global mental health organization with the members of across the world, like more than 150 countries. So, just I would like to highlight some point about it. And today in local newspaper, I read some point about the World Mental Health Day. They mentioned that across the world there are 45 crore people they suffered as of now. They suffered mental health issues. In that, actually, they try to find out in the age group of 10 to 19, there are 16% of the people belongs to the age group of 10 to 19. That means teenage people. And India, there are 7.5% from the Indian populations, they suffered mental issues. So this can be treated by giving the awareness and health education. Now, I would like to say some point about the working environment and organizational psychology in terms of World Health Organization, what they're telling, all those things. And we all know every day we have 24 hours. In out of 24 hours and 8 hours approximately going for the sleep, another 8 hours for personal care, and we know we are basically working 8 hours per day. That means that 8 hours we have to take care of our mental health, otherwise it will affect another 6 hours. As per the WHO, the bad work environment is leads to the bad emotional health. We all know. Due to depression and anxiety, there is a loss of 1 trillion global economy around the world. If there is no proper emotional health management, there will be a 4-time increase in productivity. So why all the people are giving importance to the employees' health? They are appointing wellness consultant for the health to give the best economy in the country. So in the working environment, there are a lot of issues. We have tried to understand that it's like a triangle. One side triangle is the employees, another side triangle is employer, then third one is the environment. This triangle should be coordinated very well. Otherwise, the work productivity will be actually suffering a lot. It will affect not only to the employer, it will affect the employee as well. And reducing work-related risk factor is very, very important according to the World Health Organizations. They're giving some healthy workplaces tips for us. And developing awareness in adopting different employees is very, very important according to them. And understanding opportunity and the needs of employees. We're traveling abroad, all those countries, each organization, they're having the labor welfare officer, apart from the counselor, and apart from that, wellness consultant is creating a lot of wellness program, refreshment program, creating we can say 2 months one program or 3 months or 6 months once. It will give the boost of the moral, employees moral. And there are some statistics about employees inside according to 2019 as per the WHO. 79% of workers have experienced stress at work during the last 12 months, almost 1 year. There are 22% feel stress more than not all the times. That means all are suffering due to this stress. And 47% feel that it is normal to feel stress and anxiety at workplace. That means they are agreeing that it is normal stresses. So working environmental is not like a happy place nowadays. It's creating a lot of anxiety. That's called workplace anxiety. And 53% of the having known colleagues forced to give up work due to the stress. This is everybody's accepted. And again, another statistics, 49% don't think their line manager would know what to do if they talk to them about a mental issues. So only they are creating the awareness program in the organizations. And another one more statistic is 28% took it out of their family, and 50% smoked more cigarettes, and 50% respondents engage in unhealthy behavior to cope up with the workplace stress. We should know how to create friendly workplace. A healthy, rewarding environment is important for positive mental health, and mental health friendly workplace and value diversity includes healthcare that incorporates and mental illness. These are very important criteria to create the workplace. And as I said, this three side of the triangle, first one is employer. Employer has to create a lot of programs. They have to do a lot of wellness programs for their own employees to create the to utilize the working environment. The first one is they have to create the mental health issues. Even the white collar employees or blue collar employees, both they have to give the some kind of awareness program, and they have to modify workplace risk factor for the stress and facilitate access to healthcare for employees who may need it. It's very, very important. Due to the workload, even boss and subordinates and everybody is forgetting. That's why the mentor and mentee programs happen in the all countries. Mentor will take care of not only for the technical aspect, he will take care of the personal side of the employee. This is very, very important mentor mentee concept. Employee, how they can contribute from their end. They have to know their rights. For example, their working places and working timings and work-life balance and the relations between the boss and the subordinates, colleagues, all those things. If they need seek help, they have to ask actually. So we should not hesitate to ask the help in the working place. We can talk to our mentor, or we can talk to our immediate supervisor, or we can talk to the HR department, or we can talk to the management. And co-worker, that means the team leader having the 5-6 people, so they can take care of their team mental health. Otherwise, they cannot give the productivity of that their deadline. They cannot achieve their deadline. So it's very, very important. And impact of emotional behavior of employees is very important. We know very well the workplace anxiety is creating. It's actually increasing absenteeism in the company, and it's creating negative impact of the productivity and the profit of the organization. So workplace anxiety refers to this stress caused by work that leads to anxiety or the impact of anxiety disorder at work. In the company, they will have the KPI and the KPI and the KRIs, key reference indicators. They have the quantities, they have the task, they will break the task into the small milestone activity. So there will be the deadline. So every day we have the communication system, reporting system to the boss, and we have to monitor, supervise our own colleagues and teams. This creating the anxiety. Apart from that, in the company, they have the performance appraisal system. Every 6 months or 1 year, they will do the appraisal. With the appraisal only, they will do the promotions or increment or whatever it may be. So it's creating the anxiety in the workplaces. So to avoid that, what we have to do, we have to focus on only our work. If anything, we have some extra work burden or anything, we can very well talk to the HR department, or we can talk to our own team leader. So it will really help us to reduce our workplace anxiety. So we should not bother about like performance appraisal or reviews or monthly review or monthly meetings, all those things. It's a journey. We are working for example, we are doing graduation, all those means we are trying to spend only 3 years or 4 years. But whereas from workplaces, we are going to spend another 40 years in the same field and career. So we have to take care of our mental health. Otherwise, we cannot travel for the 40 years or 50 years in the same field. Anxiety is an emotion characterized by the feeling and the tension. It worried and thoughts and physical changes like increased blood pressure. So we should not get anxiety. Anxiety will lead to the depression, and depression will because of emotional imbalance. We are getting the depression. We have to understand as per American Psychological Association, emotion is defined as a complex reaction pattern, involves experience, behavioral, and the physical elements. There are some common problems affecting employees' emotional health. Number one, as I said, workplace anxiety. Second is change in work habits. Third is increasing absenteeism. Fourth is avoiding interaction, bad communication. And fifth is lower productivity and the health problems. I'd like to give some tips for employees to maintain their emotional health. Be realistic and don't dream bad. Trust your co-worker. Be well, communicate to all. Plan and prepare checklist. All for help to mentor or boss. or anybody in the organizations. Maintaining the good relationship in the workplace is very, very important. Even if the boss or colleagues or subordinate or friends, we have a very good relationship. So we have to we have to sustain that relationship. It will improve communication skill and keep emotion under control so that we can maintain a very good relationship in the organizations, avoid gossips. These are the very important tips to maintain the mental health in the organization. Due to some time shortage, I would like to stop my session. Thank you. Thank you, Ananta.
Thank you, Salit sir. It's a beautiful session. You clearly explained about the workplace mentality and how we need to be there and how we can adjust that time beautifully and happily as we wish. Thank you for that, sir. And I allow to call now Adulya S. Nair. Just a moment. Yeah, for the title, she's going to give the relationship between physical and mental health. Welcome, Adulya, for this take on mental health webinars.
Thank you so much for the invite. Am I audible?
Yes, yeah.
So I'll just introduce myself a little bit. So I'm a PhD student. I'm doing my my thesis is on mental health in adolescent survivors of child sexual abuse. It is an intervention study with REBT. So once again, thank you so much for giving me an opportunity. I would like to extend my thanks to Munaza, who had actually suggested my name to Deccan, Positive Mental Health Group. I'd like to share my PPT. So just a second. Is it visible?
Yes, yeah.
Okay. All right. So this is kind of an amalgam. Can you see?
Yes, please go ahead.
Okay. All right.
Yellow.
I think somebody's mic is on. Okay. Anyway, so I'll continue. My topic is it's an amalgamation of what we all talked till now. It's a strong link that we keep speaking about, but nobody really gives a lot of importance to. It's a relationship between physical health and mental health. So WHO defines health as a state of complete physical, mental, and social well-being. So when we talk about social well-being, it is basically acceptance, like Muttaya sir had spoken about, the self-esteem, the acceptance in the society, where family comes into picture, where your job plays a very important role. So basically acceptance and affirmation from the society and people around you is basically what they mean by social well-being. Are you are you part of a society or a community that is accepting you for the way you are? With so many new things, new ideas coming up, is there an acceptance, which is very important part in keeping your mental health stable? So this is the definition what WHO has given, and they have rightly said that there is no health without mental health. So yes, a poor mental health is a risk factor for chronic physical condition. Now, we don't really need an explanation for this, because we all know that when there is stress, there is a rise in BP, your diabetes level, and then that obviously leads to cardiac issues. There is heart attack that is related. Then there is blocks in the the heart that happens. So there is no doubt that one of the major factors for chronic physical condition is your poor mental health. People with serious mental health conditions are at risk of experiencing chronic physical condition. One of the reasons is because of the lack of insight, because of lack of awareness, because they are not in their I do not wish to say in sense, but their awareness is much less compared to the functioning people. Let's call them dysfunctional, lesser functional people. So they wouldn't be able to have their medicines on time, or wouldn't be able to meet the doctors if it is necessary, which will obviously lead to chronic physical conditions. People with chronic physical conditions are at risk of developing poor mental health. When you are diagnosed with cancer, or when you're diagnosed with some terminal illness, it is it is very disturbing for you, because you are a lot of facets of your daily daily living is getting affected because of your these physical conditions. You are financially, there's a huge impact that comes along with physical condition. You are worried about your family. You may, you do not know how much time is left, and slowly it starts affecting you. So that is where your willpower, your drive to live has to come into being, so that your mental health is at least in control and you're able to take it together. So yes, the study found that positive psychological well-being can reduce the risks of heart attacks and strokes. This is only one of the many physical issues that get affected. Depression has been linked to many chronic illness like diabetes, asthma, cancer, cardiovascular diseases, even psoriasis, which is a dermatological condition where you have sore, red sores on your body, and then there is flakes on your head. It has got very close link with your mental health. So the first thing when you go to a dermatologist, when they see psoriasis, they inquire if you are anxious, if there is depression, if there is any stress in your life. That's a first thing that they inquire when you go to a dermatologist with psoriasis. Schizophrenia, again, like Anita ma'am had explained, schizophrenia has also been linked to a higher risk of heart and respiratory diseases, majorly because in schizophrenia there is no escape from having your medicines. So antipsychotic drugs basically has a lot of side effects. One of the major side effect is having that link with heart and respiratory disease. So moving on, I've taken only two major mental health issues that we all face on a day-to-day basis, and there is a surge in the depression and anxiety, and these are some of the physical symptoms that actually come along with depression, which is joint pain, limb pain, back pain, gastrointestinal problems, fatigue, psychomotor activity changes. Basically, you do not feel like going out, or you do not feel like doing your day-to-day activities. There's a change in appetite. You become dysfunctional. When you say dysfunctional, it is basically your cognitive functions. Your attention goes down, your concentration goes down. Then there is a lot of memory issues that comes along with depression. So these are the physical symptoms. So if you look at it, there is obviously a very crucial connection between these two. Now, the very reason why the chemistry behind the depression and the relationship between physical symptoms and the mental health is the role of serotonin and norepinephrine. So these are two, let's say, neurochemicals, which actually also it plays a very important role in response to painful stimuli that gets majorly affected, which is why these physical symptoms start coming out. And hence, when you meet a psychiatrist or even a general physician with these issues, the first thing that they ask is there a stressor in your life, if there is something going wrong in your life. So we should not be ignoring. It's not just the mood part that we have to concentrate, but if there is any physical symptom that is coming up, then definitely the first thing that we need to understand if there is any external stressor other than your internal problems or your genetic problem, which leads to depression and the other mental health disorders. Then you have physical symptoms in anxiety, which is headaches, dizziness, very rapid heart rate, panic attacks, palpitation, chest pain, high blood pressure and heart disease, stomach aches, nausea, diarrhea. Irritable bowel syndrome is a very huge physical symptom of anxiety. Basically, constipation and related issues, bowel related issues. Then your immune system is completely weak, and that makes you vulnerable to viral infections and frequent illness. Now, the main stressor here is the stress hormone, which is cortisol. So there are a couple of stress hormones like cortisol, there is vasopressin, there is norepinephrine. These are all stress hormones. So adrenaline, for example, adrenaline is a hormone that is released in a fight or flight mode. So when you basically go on a roller coaster ride in a circus or one of those places, you have an adrenaline rush. So there is an anxiety, there's a quick situation that has happened to you. It is adrenaline that comes into play, which is actually plays and reduces your it plays along with your anxiety. But once you come back to the normal state, all of this comes down. But if you're constantly in this flight or fight mode, if there is a constant anxiety, then these hormones would not go down, which actually affects your immune system, and then it affects a lot of it, suppresses your digestive system, which is why you have nausea, diarrhea, and bowel syndrome and all of that. So it's very important to keep these hormones in control, because they have specific roles to play. For example, cortisol is released from endocrine gland. The role of cortisol is basically to produce and balance glucose in your head. But if it constantly comes up, or if it is just continuously there, then it is going to affect your immune system. Then you become more prone to lot of other diseases. So for example, in COVID, like Mutaya sir had rightly said, during COVID time, the people who are, when you compare the stress levels, people who are relatively stress free or had much rational thoughts and making their stress come down, they were not prone so much to COVID. But one of the reasons is because their immune system is really high, their immunity is really high. So, and it's in a very functional position, which is why there was not so much of infections among these stress relieved people. So these are some of the physical symptoms in anxiety, which we should always be careful about and be watchful about. Then of course, sleep problems. I think something that comes with stress is sleep problems. Sleep apnea is basically snoring, and you have you sleep very loud. So when you have sleep apnea, then you really very disturbed sleep. You have insomnia is absolute lack of sleep. So the research says that 50 to 80% with mental condition problems have people with mental health conditions have sleep problems, which comes with it, because you're constantly thinking, there is ruminating, repeated thoughts, and everything is there, and hence that leads to sleep issues. 10 to 18% may have sleep problems, but without any mental health condition. That is, very short term or a very temporary state. What to do? This is what we have to think about. Very regular blood tests and body checkup is very vital when it comes to understanding the relationship between your physical problems and mental problems. Your blood test will tell you, if there is a deficiency in B12 or vitamin D. These are very important, especially when it comes to women. Why? Because cortisol in general gets into your bloodstream, and it reduces the absorption of vitamin D, which basically again leads to stress. So when vitamin D goes down, your mood is affected, your physical activities are affected. So it is very important to have regular body checkup and regular blood tests to understand if there is any lack or increase in these hormones and the blood levels. Exercise regularly. I think 3 or 4 speakers already have spoken how important it is to exercise very regularly, because exercise, of course, it is pleasurable in a way. You will get a chance to go out, meet people, definitely. But the scientific part of it is that it releases a lot of happy hormones, which is your endorphins, serotonin, very important in regulating your mood and in generally being happy. So
a few more minutes.
I'm winding up, ma'am. It's done.
Yeah.
So it's very important to exercise very regularly. Try to identify the external cause for your stress. Exams, for me, I'm doing my PhD, so it is a huge external, cause for my stress. Basically, if there is a lot of family issues, work-related issues, try and identify your stressor. Because once you identify your stressor, then you know what to do. When you do not know the problem, then it is difficult to find the solution. So it is very important to identify the reason why the stress is happening, or reason why something from outside, not internally, from outside, is causing the stress. Healthy diet, timely food, very important. Nutritious food is very important. Every food has its own nutrients, be it junk food also. If you actually break it down, even junk food has its own nutritional value. So it has to be a balanced diet. It has to be a balanced diet with nuts, and because nuts and oil has a lot of nutrients, which actually acts as a substitute for a lot of hormones. Again, protein rich food, carb rich food, it's very important. This is all things that we all know, but we don't follow. Sleep, again, 6 to 9 hours of sleep very, very necessary. We tend to spend time, especially my generation or the younger generation tend to spend a lot of time in front of TV or social media. It is a huge problem, and it actually is reducing our sleep and leading us to a lot of mental health issues. I personally do not know anybody who has not gone through a mental breakdown because of lack of sleep. It's very important. Make sure that you get that 6 to 9 hours of sleep. Relaxation techniques, meditation, a simple walk, music, whatever gives you happiness, dance, or just chit chat with your family members, just a video call, take some time out, whatever gives you that relaxation. Please try to include that in your daily routine. Mindfulness is to know that something is happening. Being mindful about what you're surrounding, yourself, your health, yourself, very important. And then doing things accordingly, that's mindfulness. Being stressing a lot on your positive thoughts and trying to avoid your negative thoughts. Avoid alcohol, drugs, very important. Again, they have very bad health. It gives very negative health. It leads to a very negative health condition. Smoking, again, they have so many researchers that have led to the result that smoking decreases all these hormones, and then that is why it's again got a lot to do with the fight and flight response. Seek help. Last but not the least, there are so many advocates of mental health and therapists around you. So if you really need help, please do not hesitate from meeting a psychologist, a psychotherapist, somebody who has a background in this, and of course speak about it. Ask them what to do, or if you have a friend who would listen to you, please go open up instead of taking the extreme measure. So I would like to conclude the whole. Of course, there is a recent study that has found that people who exercise report 43.2% less days of poor mental health than those who didn't exercise. I believe exercise does a lot of things to you. So please be physically active. It will reduce a lot of stress related issues in life. So yes, I would like to conclude by wishing you all a happy and healthy life, both physical and mental. Thank you so much.
Wow, you explained clearly about that one. The research student now, so you step by step you explained everything in a very beautiful manner, and it is attractive too. And we all will listen to you. Yeah, thank you for this one. And I welcome Shwati Shrikant for the next speaker. She is going to talk about the art therapy. Shwati is our Smita ma'am's sister and sister to me also. She did so many webinars regarding these art therapies and all. So over to you, Shwati. We are very eager to hear you.
Yeah, good evening, everyone. Art washes away the soul, the dust of everyday life, said by Picasso. Same way, we can reduce our stress, tension, anxiety using art therapy. It is a creative method of expression used with therapeutic techniques, actually. Art therapy can be life-changing for people because they use their creativity and it improves our mental health. Mental health is something that impact everybody in past 2 years. Everybody is a creator. We have a lot in ourselves. With a simple paper and a simple pen, we can draw. So that helps us to reduce our stress, tension, and we can use different lines and colors. With that different lines and shapes, we can judge what the person is going through. If the person cannot speak to other or they can't express their feeling, during that time they can use this art therapy, and with help of art therapy they can express themselves. Actually, this is a language of self exploration, and it can relieve things, even lines and shapes, colors that they use. So we don't make any judgment with the art. That is simple art, what they are going through. The children will scribble, even some elderly person also, they scribble. That represents they are undergoing some stress or some tension. If the person is using straight lines and a very pattern, and they are happy, and they are going through a good time. So art therapy is a powerful health enhancing treatment, and it is widely used in mental health. What are the benefits of previous slide, Surindama? Yeah. What are all the benefits of art therapy? It is an effective method. It can be used in cancer patients, depression and other disorders, and it can be used for a person and who are survived from a natural disaster and man-made disaster, and to reduce their negative stress, improve their interpersonal skills. So who all can benefit from art therapy? Children they can do, adults, seniors, and couples they can do. And the purpose of art therapy is healing, self-healing. So yeah, thank you.
Thank you, Shwati, for a beautiful session. And thank you, Sunanda ma'am, for sharing the screen too. And I love to call now our Sudharamani ma'am on the topic stress management to story metaphor. We are very interested to hear that, man. We all love to hear the story, right? So, ma'am, the session is over to you, ma'am.
Yeah, thank you. Thank you, Shali. Hi, everybody. Good evening. Many of the topics were covered. I mean, about the stress till now, many of you have covered already. So I would like to tell in the form of a story only, as my title is there, I have given. So it's a story told by, I don't know the name of the psychologist, but in one of his books, he mentioned about this story to tell about the stress. It's a metaphorically, in the sense, let us see how you can relate it to you. There is a thick forest. In that forest, there is a tiger. It used to kill. He used to kill small animals for the living. And someday he got fed up and thought of killing a big animal so that he need not hunt for many days. So he searched here and there in the forest. He saw a huge elephant. Wow, what a nice thing. I mean, if I can kill this elephant, I don't need to rush for food every day, he thought, and he tried to attack it. But it is a huge and wild elephant. The elephant did not allow him to kill him, and instead the tiger got scared and he ran away. Then he thought for a while what to do. I mean, I want that elephant at any cost, he thought. And he spoke to two other tigers in the forest. So three of them sat together and thought of having a plan to kill the elephant somehow. One of the other tigers told, you are only telling that it is a wild elephant. He is so huge and powerful that he kicked you. And even though one he is able to kick out of the scene, so three also he can kick or kill also. We don't know what will happen. Then we cannot kill the elephant with our power because it is huge and powerful than us. So we need to think in a different style. We need to apply different strategy. And they call monkey. Okay, please remember the animals names which I am mentioning. So he called the monkey. They called the monkey, and they told monkey that when we are hiding in the grass nearby before attacking the elephant, you have to distract the elephant with some bananas or something interesting for the elephant, which the elephant likes. Okay, the monkey said. And when they were discussing in the forest, there was a wise owl sitting on the tree. The owl heard everything and it rushed to the elephant and told everything. These people, these 3 tigers and monkey were discussing to kill you. Please take care of yourself. Then earlier the tigers were stressed and they don't know, they didn't believe their own thing, and they got feared and they took somebody's help to kill the elephant. Now the elephant's turn. Even though he is huge and powerful, he started thinking how to save it. Itself. Then obviously he spoke to wise owl only. Please help me. How can I save myself? Give me some idea. Then owl told, there is a pond in the forest. So you sit in that pond. Don't come out of it. Even though the tigers are going to attack you, you're not coming out of the pond. This owl said. Elephant was confused. Tiger can swim nicely in the water. How can I save myself? Even if I'm sitting in the water, it won't help me, it said. Then owl said, the tiger is not as powerful on the land. It's not powerful in water compared to land. So, okay, it said. And one more thing the owl said was, never ever get distracted by the monkey's actions. Don't pay attention to what monkey is telling you. So whatever you can do to the monkey, you do it. Then see what will happen. Then the elephant followed the same. He sat in the water. The monkey tried to distract the elephant with some bananas and all, but with its mighty power, he threw away the monkey with his large trunk and kicked the tigers. All the 3 tigers were kicked out of water when they were trying to approach the elephant. And that is the end of the story. The elephant was saved. So in this, what are all the animals' roles? The tigers were there, monkey is there, elephant is there, and owl is there. So here, the elephant is the physical ourselves. We can relate it to ourselves with all physical health, mental health, and emotional health also. So the tigers are the stressors, stress related. What are all the different stresses we are facing in our life? The monkey is our, can anyone tell what is the monkey? I already indicated, of course. Yeah, mind. Our mind, which distracts everybody, which pushes us towards the stressors only. It won't allow us to see the positive side of our life, only towards the stressors. So the wise owl, what is wise owl? In our body, where can we relate the wise owl? Can anyone come forward and tell?
Our brain, ma'am.
Brain, of course. In brain also, if we have taken the hand model of the brain, this is the primitive brain, this is the lower brain and upper brain. And the primitive brain is as fight, flight, and freeze mode kind of brain. It helps us to follow that. And this is the amygdala in the lower brain, which has the emotional control and whatever it makes us dance to situations. And the upper brain, that is the thinking brain, which helps to calm down the emotions and helps us to balance ourselves. That is the owl here. So when the elephant kicked off the distractions, the stressors are gone, obviously, and the thinking brain, first is it paid attention to the thinking brain so that it can distract the monkey, and the stress is also little less is almost nil. In everybody's life, we see all these stressors in our life, we see, but only thing we forget, our elephant forgot its strength it has. It is a mighty animal, and he forgot about the energy and strength it has. The tiger is also actually, in a way, he forgot about himself, his energy and power, everything he forgot. And the fear overpowered the stress over here. When we give importance to fear, we forget about our strengths and everything, and we tend to give ourselves to the weaknesses, and we'll lose ourselves at the end of the day. So here this story tells us that we need to focus on what we have in our hands. Only focus on the things which are in your control. If you stress about the things which are not in your control, definitely you feel stress and you end up feeling miserable, and nobody is there to help me, like that. Many things, suicidal tendencies, everything will come up. So I hope this story makes sense and it is related to the stress. And in this also stress, I would like to tell 3 kinds of things I have seen. Many of the immediate stress, stress we can focus on like a breathing techniques of 5, 4, 3, 2, 1, that breathing technique, listening to the music immediately. If you are feeling stress, instantly relief, if you want, you can focus on this 5, 4, 3, 2, 1 breathing technique, abdominal breathing, or listening to music, or nature walk, as she said, go out and walk for some time. And daily routine habitual things we can do. And yearly also we can follow some stress relief techniques, like going out for a vacation, enjoying with our near and dear, like that. I hope you like.
Thank you, ma'am.
Thank you, Sunanda, for giving me the opportunity.
Yeah, we'll convey it, ma'am. Thank you, ma'am. It was a beautiful session, and we love your story and the concept also. We got it. Thanks for that, ma'am.
Thank you.
Participants, if you have any queries to any particular persons, please, only 5 minutes we allowed for that one. Anybody want to ask any questions, please come forward. If not, we will move for the VOT. Yes, Mary ma'am, please come forward.
It is World Mental Health. All the sessions, different topics. It's covered now. It is very informative. I learned a lot of things. I have no questions because I'm here hearing too much about mental health today from morning. I also attended Niman sessions and I came here. So it is very takeaway for me. Lot of all the speakers are all my best friends here who spoke on the panel. So congratulations to everybody. Only Sunanda's sister and this now speaker, I don't know personally. So other than that, all the speakers are my friends. So God bless you all. All the best in future. Take care.
Thank you, Mary. Hereafter, they will also become your best friend. I hope. Sudha and Swati also. I think so. No other queries here. We need to move another session also. Sorry for that one. So we will conclude the session. And I allow to call Manga.
Yes, ma'am. Yes, ma'am.
Yeah.
Good evening, ma'am. Good evening. Good evening, everyone. We would like to thank the expert for sharing their knowledge on the organizers, participants, and teammates on behalf of Deccan Positive Mental Health, Manasa Sukkara, Hyderabad, Helloban Wellness Center, and India, Forest Creative Studio, Punjab. Thank you so much, everyone.
Thank you, Manga.
Thank you so much, ma'am.
And thank you, participants. And thank you, ma'am. Thank you, all the speakers, for the beautiful presentations today you gave. You all made our day. Thank you. Thank you for that. Bye. Take care.
Bye.
Thank you, Vishal, and thank you all the speakers. Thank you so much.